when we were advised about the COVID-19 pandemic and the changes that we had to make almost overnight, and the way we practice medicine and the way we conduct ourselves at our offices and basically how we see our patients. I mean, we pretty much overnight sort of transformed from a in-house ability to see patients to converting all of our visits to virtual care, so speaking to our patients over the phone. As much as we're trying to keep things as normal and status quo as we can for our patients, there is so much uncertainty for our staff and for the physicians as well. A lot of anxiety about whether the offices will reopen, what that's going to look like. Are we going to be able to manage to pay our rents? And keep the office going so that docs have a place to come back to. The reason we got into medicine is to help patients, to serve patients. I think most of us take that responsibility very, very seriously. Those patients, without the care that they require at this point, or the fact that they're not coming into the office, those patients are potentially having a significant worsening of their problems. You know, the patient who was 2 weeks away from a knee replacement or hip replacement, at this point now we don't know when they're going to be seen. They are in an incredible amount of pain. We're managing them a lot of times with opioid medications, which, you know, is a crisis in and of itself. But now the time for them to be able to get back to the surgeon, to be able to have surgery that is necessary, is going to be pushed back by months and months and months. The infrastructure that we physicians out in the community, fee-for-service physicians, family doctors, specialist surgeons, and a significant portion of our billings go towards that infrastructure. At this point, if we are not paid by the Ministry of Health, the threat is real. I think something like 40 to 49% of family doctors' offices and specialists out in the community on a recent survey said that they would be forced to close their offices. So imagine if even 25% of practices closed. Where do those patients go? We need support for that infrastructure so that we can continue to see patients through this pandemic.